thanks to our guests on AM Talk. Now, let's talk about another matter confronting the nation now. Well, this is happening in Kumasi, but if we don't take care, it could explode. Now, the Komfo Teaching Hospital chapter of the Ghana Association of Medical Laboratory Scientists, as you may know, have been on a sit-down strike since last week, protesting the posting of 2 medical specialists to the Laboratory Services Directorate of the facility. Calls by the Ministry of Health and management of the hospital for the scientists to resume work for dialogue to begin have yielded no results. Now, they say they will only go to the negotiation table with the management of the hospital when there is an assurance that their demands would be met. It's on the back of this that we're speaking to Dr. Dennis Jesse, who speaks for the Medical Laboratory Professional Workers Union. He joins us via Zoom. Good morning to you, sir. Thank you so much for your time. If you would kindly unmute. So we could, yes, good morning. Great. So are you still striking today?
Yes, for the chapter in Komfo, I would say yes. They are still on the sit-down strike. Yeah, so if you ask specifically on that, the Komfo Teaching Hospital staff, the chapter for the Ghana Association of Medical Laboratory Scientists are on a sit-down strike, as they had indicated.
Okay, great. If this is an issue peculiar to Komfo Teaching Hospital, why is there a threat that this could blow out and affect other facilities?
Well, so the thing is, we've always believed in the adage that whatever is confronting the practice of medical laboratory science and happening in Komfo should not just be seen as something happening in Komfo alone, especially when we have the cause to believe that it's rather feeding into an agenda, it's rather feeding into an objective that except doctors who have specialized from the Ghana College of Physicians and Surgeons are in charge of our laboratories all the way to the district levels, except doctors who have done that specialization at the Ghana College of Physicians and Surgeons are the people responsible for validating our results, except doctors from the Ghana College for Physicians and Surgeons are the people who will supervise medical laboratory scientists. If that is not done, our results cannot be trusted, our results cannot be used. And if you see some of these trainees and some of these products from the college, when in 2015 they were sent to Kolebu Teaching Hospital, knowing the agenda, they were resisted. It led to another protest, another strike action. Then you repeat same in Komfo Teaching Hospital for the past 2 years, and nobody is talking about it because the CEO is a superpower, is superior, he speaks and nobody can talk about it, and that is still is lingering on. Then we have a cause to concern that there is an attack on medical lab practice in Ghana, and we can't sit aloof just because it's in Komfo. This is affecting the entire practice of medical laboratory science. And that's why we made a call that whatever is happening in Komfo, if attention is not drawn to it, and the chief executive officer and his management are called to order to withdraw that appointment they have made in view of the fact that the situation is at the Labour Commission that we are looking into, we will advise ourselves. And it's quite unfortunate that we have allowed it to come this far. Komfo with a roadmap up to tomorrow, then don't be surprised to see the national scale where lab scientists will definitely also advise themselves on this same matter.
But Dr. Jesse, Komfo has explained that these 2 persons, for which reason your colleagues are protesting, or including yourself, because it's a local chapter from the mother group, these 2 persons are not in this particular department. They are not with the medical laboratory professionals necessarily. So is it that they are supervising the work of the the medical laboratory professionals from wherever they are? Is that the issue?
If your system will allow, you get it, I could share some things with you. Read in between the lines and let us know who is speaking the truth. Read in between the lines And it will take only people who are short-sighted, who are not looking into the future, who cannot predict when somebody is trying to achieve an objective. In 2012, the Ghana College of Physicians and Surgeons came round to check Confanoche to see if they can accredit the facility for them to train specialists in this same area from the college. When they came round, I have a copy of the report. And the report states that Confanoche at that moment cannot be accredited for the fact that it was not a medic who was in charge of the hematology department. Fast forward, you go and train and bring these people into that same department. The very moment they have been brought in there amidst the protest, then you get the accreditation checklist from the college. We are now coming to what? Do the accreditation. And for that matter, the recommendations that had been given in 2012 is being satisfied, because now you have the medics over there. They are definitely going to be the people in charge. So accreditation is going to pass. So we don't have to be dumb for us to know that this thing is working to feed into a bigger agenda. And the agenda is that laboratory scientists will have to be supervised by medics. GMA is holding that same view. Ghana College of Physicians and Surgeons also holding that same view. So if you remember very well, when this matter broke, in 2015, Kolebu Teaching Hospital went on a strike. 2016, on the matter of the policy, the National Health Laboratory Policy, the very reason why Ghana has been denied of a National Health Laboratory Policy since 2013 is the fact that College for Physicians and Surgeons are saying they are stakeholders in the health industry, and for that matter, for a policy like the National Health Lab Policy can only exist if we put in a policy statement that laboratory physicians are the ones to be the managers of our laboratories, those who are registered with the Ghana Medical and Dental Council. That alone excludes people like us. So it means that they are coming in with the mind of exclusivity. And now you bring those people in Confanoche, the very thing that happened in Kolebu and brought about a strike. And so, you say that we should sit aloof.
Dr. Jesse, help us understand. I mean, this is a very technical area, so not all of us can easily appreciate the point that the two sides are making. So medical laboratory scientists and these medics you talk about, what's the difference in their works?
So in simple terms, if you go to the hospital right now and you are to see a doctor, you go to take your card, go to the consulting room, and once you give the symptoms and everything and your history, the doctor will make a request and say that, oh, the way you are coughing and the way you are sweating and the itch you have and how you have explained the headache with probably the palpitations, your heartbeat and the rest and stuff, we suspect in this era it could be COVID. So kindly go to the lab, take a sample, run the COVID test. You bring us results back in the consulting room. The doctor will look at the results with the history and finalize by saying, oh, yes, it's confirmed, you have COVID. Then they now refer you through the processes for you to seek management. So these lab physicians in hematology, what is expected of them, they are largely going to manage people who have leukemia, people who have multiple myeloma, diseases or conditions that are cancerous. In fact, cancer condition, let's put it in simple terms. So the cancer patients are not coming to the lab. The cancer patients are supposed to be seen in the cancer clinic. For that matter, when they are in the cancer clinic and they go to consult over there, because they have specialized in that area, they will know certain specific tests that they will request. So just like the doctor would have requested for malaria and look at the level of your blood, these ones will also request for certain things like phone comment. For that matter, they will go into your bone, pick something from the bone marrow, and bring it to the lab for us to check whether the cancer they are seeing is coming from which line of the cells that are produced in the bone. So they will do a bone marrow aspirate. If it's about sickle cell patients, now Rage Hospital is having the capacity to do some gene therapy, gene replacement therapy. So that one too, they will look into it They will bring it to the lab. The lab will do the necessary tests that will help confirm their suspicion.
Okay.
But here is the case. So that is how it would have happened, so that we will have that kind of separation of practice and everything, just like how all practice is like. But for these particular ones, their intention is that let's send them to the lab. They are part anything in the lab, they are counted as part of them. In fact, some of these ones in confirmation now are even doing form comment. Instead of them to refer and the lab will rather do the comment and send them results, they are rather doing it and reporting on their own.
Okay, so
we
Dr. Jesse,
lady in Confanochi who was doing that. They said they can't trust it unless you have what? MBCAB, which is the basic requirement for a doctor. So if you don't have that, you can't report slides for them to use. And that's why they are bringing these people to the lab to make them as part of the lab staff.
Okay, so the fear,
staff list of the lab, these doctors are not part of them.
So the fear is that they are coming to take over the job of the medical laboratory scientists. Is that it?
Exactly the point, and to manage and supervise them and validate our results. So
okay,
if next time I'm doing malaria test for you, what will happen is that this lab physician will have to be there, and once I finish and I write the results, I will put it on her table. Madam, dear sir, I am done. Can you look at it and sign and let it go? It's exactly what they seek to do. And I have a document to show that when they met the IET committee, that is what the medical GMA is saying, Ghana College of Physicians are saying, that they need to supervise the labs.
Okay, I get it, but what is, apologies, and I'm asking only because I don't understand these things. What is fundamentally wrong with them validating what you've done?
What is fundamentally wrong? Let me use myself as an example. I have gone through medical lab technology program at KNUST, first degree. I've had my master's in infectious diseases. I got my PhD in immunology. And currently, I'm also a consultant, a fellow, West African Postgraduate College of Medical Laboratory Science. And you think by rational thinking, whatever level of experience for the past 15 years, I will need somebody when I have gone to check my machines, I have run my control, and you needed to know the level of blood of the people that you have referred to me. After I have gone through all my quality checks and quality processes, and I have done and I have reported, and I have brought it, I need another person who never went through the processes of generating the results to rather write on the report that this is okay, this is not okay, it's accepted, it cannot be accepted. Is that what we are saying? In any case, the doctor who requested, if he needs any further interpretation, why can't you sit with him and rather give him that education? Should it be that what I am doing, that you were never part of the processes, you rather want to come and sit and say it's good or it's not good? So if next time I give you wrong results because you didn't generate it, how do you know it's wrong?
Okay, so I
even go there at all.
Okay, so I appreciate the issues now. But what is the standard practice elsewhere?
The standard practice elsewhere is medical laboratory science, in UK in particular, when it's a protected title. In Ghana, it's equally a protected title under the regulations of Allied Health Professions Council. If you don't have the license to practice the trade, there is no way you can ever even go and carry yourself aside. And Ghana here is saying, if you carry yourself as an allied health practitioner, medical lab scientist, and you don't have that qualification, that license from the Allied Health Professions Council, you are creating an offense that is punishable by law. Go and check the offenses under Part 120.
Okay, another thing, Dr. Jesse. So is this being practiced at Kolebu, Tamale Teaching Hospital, the Accra Regional Hospital? Is this being practiced in these places?
Nowhere in Ghana is it practiced. I told you in 2015, they tried that in Kolebu Teaching Hospital. That brought up a strike. On your platform, I can show you a news item that gave that indication as well. So you carried it as well on your platform. So that was made, the attempt was made. It was resisted because it's a similar manner. And currently, I've told you the issue is even with the Ministry of Health and the Labour Commission when we are trying to resolve this impasse.
So why is the management of Konfo Anokye not on the side of the medical laboratory scientists?
Oh, I don't think we need a seer to come and tell us this. Medics are all over. You hardly can touch them. You can't speak the truth to their face. They are seen as the thing gods of medical practice, and whatever they say should come to pass. And for that matter, even when matters concern them or does not concern them, they can equally come out and talk of what is illegal and what is not legal. So it's just as simple as that. The leaders and the managers of our health system have been so much afraid to speak the truth to the medics.
So yesterday,
balance, they are the ones in charge. They are the managers.
So on Monday, Dr. JC, not to cut you, I listened to a management member of Komfanochi who said that you guys are actually friends. I mean, you went to school together. In most instances, you sat in the same classroom. So there was going to be a conversation, an informal conversation to get you guys to come back to the table. How did that go, if it happened at all?
I don't think any informal communication has happened. What had come to my attention was that through the PRO, there was a call on the leadership of the chapter, but apparently they wanted a documentation to that effect, but I don't think they were interested in that. I don't see the need for that kind of info. What is the informal communication here? There is an issue at the Labour Commission. The impasse has not been resolved. Then a subordinate in this matter, a CEO under the Minister of Health, when he has not taken a resolution on a matter, he goes to do appointment for the past 2 years, and we are looking on. And you think that it doesn't suggest to us they support what is happening in Komfanochi because it's about medics, because they are in charge everywhere.
There's also another reasoning, Dr. JC. There's also another reasoning that these appointments were, or the decision was made by the board. And so management cannot take a decision, cannot reverse a decision that the board took.
My dear, do you believe that? Do you believe that? Isn't it just one of the reasons somebody is giving for inefficiency and probably to call a bluff? So are they saying till a board is in place, Komfanochi should collapse? Are they saying till a board is in place, if the board had made certain decisions that apparently was against the law, we should still allow it to sit and move on till another board comes to what? Rescind that decision? I think those who may want to agree with that could go ahead and agree with it. But for us, it only suggests to us that when it's about medics, when it's about the superpowers in the health industry, forget about it because nobody is going to speak on your behalf. And no wonder this is the only chance and the only avenue that the lab scientists have chosen to dress home and drum home their grievances. Because all the way to the top, we could see clearly that no one is interested to talk about the matter. So because these are the people who have dared the ministry that if you deal with this manner, we are going to shut down the health industry. And they can do it. And because of that, nobody wants to talk about them.
So, Dr. Jesse,
we have to say only 2 people. Because of 2 people. Where were they? These people were in oncology. They went to internal medicine. Initially, before they went to school, they were at the blood bank. But there is another medic in all these areas, and they know they can't rise through the ranks and become the specialist they want to be. So let's go to the lab. This is the truth of the matter. Nobody wants to talk about it. And we are rather dilly-dally and a board and that and that and that.
These people at the center. These people at the center of the controversy. The reason why you're on the strike. How long have they been at this position?
For more than 2 years that they were posted to. I think since 2008, somewhere in August or November, and letters upon letters have been written seeking the listening ear of the CEO. He never minded anybody because they say that they are the appointing authority. They have the power. They could do what they do and assign where they desire. And no wonder the GMA came to support that the employer has the right to appoint them. So don't be surprised next time you go to Komfanochi Teaching Hospital and a cleaner will be in the consulting room because they have the right and appointing authorities they can put wherever they so desire. There are laws, for Christ's sake, that we all need to obey and just heed to.
So what is new today? Is there a scheduled meeting?
For today, I have not had any communication of a meeting, but in the news that colleagues have mentioned to me, there have been headlines indicating the National Labour Commission is suggesting somewhere next week they are going to call for a discussion on the matter. I'm yet to confirm from the Secretariat if that communication has been received. But as far as I'm concerned, until this discussion, I've not had any communication to the effect of something happening. So the status quo remains, and we will keep protecting the profession. we will never and ever remain subservient to people that seek to say that till they come to control. It's happening in radiology. You take an X-ray now, no matter the experience of the radiologist, you will still need a doctor to come and sign on it and give a comment on it before you can go and use that X-ray. How many are there for us to be putting that priority ahead?
You know, just
we have to be serious as a country.
Just before we bring this conversation to a close, there are patients now who are now resorting to private medical labs so they can run their tests, which is costing them a lot more. But the point is, Komfo has put in place some kind of measure to mitigate the impacts of the strike. So would you say that you're making an impact with the strike? Is the hospital really feeling the absence of medical laboratory scientists? I guess is the question I'm asking.
Well, it is for the public to kind of judge. Already when we are in place, you have these same doctors referring cases to private facilities. They can tell you in the face, take it to this lab, go and do it there. And not. So it was happening already. But it's a matter of how many of them can pay. Is health insurance going to pay for these services? So if we think that is the easier way out to solve the problem, we are okay with it. And in fact, we are comfortable. There is no impact and patients are not suffering. So we can let that status remain and let's keep fighting. But if they think that is the solution, then we thank them. They have found a solution to the problem they think we have created. Let's watch from Thursday that the people at the various districts, the people at the various facilities across the nation, they'll get the private people to go and do that. In any case, the private facilities are part of our membership, the APML, and it will surprise you to know that these people are on standby, waiting for the call on the profession for them to deliver. Because if we allow this to sit, you go and get a private laboratory and you need a lab physician to go and supervise that place. So for them to, they have to know that threat is coming to the practice of their trade. And if we will sit down and allow this, that the few doctors we have around, that they are not even enough. A doctor-patient ratio almost 1 to 10,000, about 15,000. And we think that the priority is where the professionals are already developed, like the lab for that matter, as I cited. Let's rather get more consultants to go and add to them, go and manage them, go and supervise them. How far can we do that as a nation? Well, we have to spend our resources in that manner.
Dr. Dennis Ajayi, we will continue to monitor this situation and where it develops to, but we appreciate your time on this conversation. Dr. Dennis Ajayi speaks for the medical laboratory professional workers. We know the Komfo chapter for now is on a sit-down strike, and they're threatening, they're asking us to watch this space by Thursday. If their concerns are not addressed, they're going to blow that out and expand it to the entire country. Hopefully, it doesn't come to that.